Namaskar and good evening, guys. My name is Dr. Diptarka Bhattacharya. I'm an ENT and facial plastic surgeon, and I work with Apollo Spectra Hospitals. Today, we're going to talk about nasal obstruction, the various causes of it, and what are the different treatment options that are available. Now, when we talk about nasal obstruction, you've pretty much every single person in this room and who's listening to this, I'm sure you've felt your nose being blocked at a certain point of time. It could be allergies, it could be like you had a very bad cold, it could be that you had COVID, with the last couple of years. There are so many different reasons that your nose can get blocked. So the first thing is that because nasal obstruction is very common, we have to understand what are the different things that can cause nasal obstruction, how nasal obstruction happens, and what are the different treatment strategies that are available to us. So the first thing that I want to talk to you about is to understand how breathing happens. What is the nasal passage? What is the pathway of breathing? If you understand that, then you'll understand where nasal blockage occurs from. So the first thing that I want you guys to understand is if you look at my nose, you see how the nose goes up like this? The nose does not go up. The nose actually goes this way. So if you understand that the nose goes back this way, then you will know that the holes right here, the nostrils, are not actually in the front of the passage. The nostrils are at the floor. So if you imagine the passage going like this, it's a pipe that is turned down like this. That's where the nostrils are. So whenever you breathe, even in normal times, your air has to enter like this. Air has to turn at 90 degrees and then go back all the way until it reaches the back of the nose. Once it reaches the back of the nose, then there's a common passage, which is basically the top of your throat. And that's where the air passes to on its way to lungs. Now, there are a few other structures that are very important on this pathway of the air. So let's imagine for a second that we are in a 3D camera and we've turned inside. We've entered through the nostril and we've entered the point where the air has turned at 90 degrees. Now, the air is supposed to flow through the nose. Now, as it flows through, there are two shelves that hang out on the sides of the nose. These are called inferior turbinates. The job of these inferior turbinates is to add moisture into the air that you breathe so that you should never get very dry air into your lungs and it should not dry out the back of your throat and your lungs. So these are the main ways in which air travels. So if you understand that, now let's go back and see what all can cause nasal obstruction. So obviously, obstruction can happen where the air is entering, so at the nostril. It can happen where the air is turning. It can happen when the air is going down straight down the passage. All these three things have different pathologies. So once someone comes into my clinic and says, "Doctor, my nose is blocked," the first few questions that we talk about is always A, is it blocked all the time? Or do you notice that it gets blocked in specific situations? Like, for example, you enter an AC room, or when you go to bed, or when you try to lie down, or if you drink beer. Is that when you notice that it is blocked, or is it blocked all the time? The second important question is, when you see a blockage, is the blockage for both sides, or is it on any one given side? And number three is that have you found that anything improves your nasal blockage? And all of these things have importance for us. So that means that if your nose is blocked all the time, then obviously we are thinking about something that is actively blocking the passageway. And this can be something like your deviated septum. That means where your nasal bone has slipped off to one side and is blocking the nasal passage. It can be something like a polyp or a mass that can happen in some people with allergies that is blocking the nasal passage. It can also be other rarer things like some kind of nasal tumors and adenoids, which is a type of tonsillar tissue that can grow in the back of your throat. Now, before I go into anything else, let me just take a step back and cover the most important topic that we are here today to talk about. So when we see nasal obstructions, if 100 people come into my clinic with nasal obstructions, approximately 70 to 75 of them, their basic cause is a deviated nasal septum. So let's talk about a deviated nasal septum. Now, if you think about a deviated nasal septum, the first question is, what age group does this usually bother people? And the most common age group at which I do these deviated septal corrections is around 28 to 35. And when I tell my patients that, the reason your nose is blocked for the last year or so and it's getting worse is because of your deviated septum, the first question that I get from them, or they should be asking me, is okay, but I haven't got hit on the face recently. There is nothing that has gone wrong. I have had no trauma. So if my septum was deviated, it must have been deviated for a long time. So how come it's bothering me now? And the answer is really simple. So you see, when you're a child, your nasal septum is actually a big piece of cartilage that separates the nose into right and left. So because it's a cartilage, there is no pain or there's no trauma. But if you get hit on the face, even a small injury can cause that cartilage to crack. The difference is that because it's a cartilage, it is flexible. So even if there's a small crack in the cartilage, it can still kind of breathe around it and it doesn't cause you any obstruction. But as you start getting to the 30 years of age mark, all of our bodies undergo a process called ossification. And that happens to the cartilages in the nose, it happens to the cartilages in your vocal cords, your larynx, all of these cartilages. And what it means is that simply the amount of calcium in these cartilages increase. So they start becoming more and more fixed in their position. Now, as they start getting more and more fixed in their position, that is when you start having breathing issues. Because the breathing, you cannot breathe around it anymore. Now, around 28 to 30 years of age is when your nasal passage is actually blocked, because this thing is now firmly fixed in position. One easy way to understand this is if you see a leaf, when it is green, you see how the leaf is flexible, but as the leaf dries up, have you seen how the dried leaf changes shape? That's kind of similar to what happens. As it becomes more fixed, it cannot have the flexibility that it had, which is why the shape changes. So that's why around 30 years of age is when I see these problems. So what are the problems that people usually come to me with? Number one, blockage. I can't breathe well. Number two, my allergies. I never had allergies. Over the last 1-2 years, I've become very sensitive. I start sneezing when I breathe something. Things like frequent colds. And when I catch a cold, it takes a long time for it to go away. So when people tell me that, and I look inside, now let's explain what exactly happens. Why do you get all these symptoms? So what happens is, suppose my nasal septum is in the middle. Then I'm breathing through this much space, right? If my septum is deviated, then the space narrows. And if you remember, when we started, I told you that there were these shelves on the side called inferior turbinates, whose job is to add moisture into the air you breathe in. Now, as this narrows, obviously, if my air has to pass through a space that is half the side, air has to flow twice as fast to go through that space, right? So if air is flowing twice as fast, that causes more drying inside the nasal passages. Because there is more drying, these shelves, which are the inferior turbinates, are working overtime to moisturize all this extra drying that is happening. So what happens is, over a year or so, these guys have enlarged to 3 to 4 times the size in somebody else. So when my patient walks into my clinic, their inferior turbinates are about 4 times the size of somebody else's inferior turbinates who does not have nasal issues. Because these inferior turbinates are enlarging in size, they are further narrowing the space. So airspeed is further increasing, there is more drying, it's a vicious cycle. So as you understand, the nasal obstruction slowly gets worse. Other things that start happening is, as this turbinate starts sticking inside your nasal passage, when you breathe in, every single dust particle that is there in the air falls on these turbinates. And they irritate the turbinates, and that's why your allergies get more sensitive. Remember, allergies is something that is in your blood and it is related to immune system. So allergies will always worsen when you're a teenager or when you're a 50-55-year-old age person. Because at teenage is when your immune system is maturing. At 50-55 is when your immune system is declining. At 28-30, your allergies, your immune system is rock steady. So your allergies cannot worsen unless you have moved from a different climate to a completely different one. For example, if you've moved from Bangalore to Toronto, you can have a flare-up of allergies. And that does not mean that it is something else. But that should settle down within 2 years. If it doesn't, then that means there is something else. So these are the ways that we understand whether this sensitization is happening because of bad allergies or if it is simply because of the fact that physically your turbinate is so big that it is acting like a giant strainer and is catching every single dust particle, right? Other things that happen is a lot of these guys, they find that they start having headaches, they start having colds, they start having pressure, and they start having dry mouth and sore throats. The reason they have these sinus pressures, all these things, is very simple. Your sinuses are like big cavities in your cheek and your forehead, and they're like an upturned bottle, right? So they're big inside. Where they open into the nose, they're small. That narrow opening in medical terms is called an OMU, but you can just think of it like an opening of a bottle. Where they open, there's another flap of bone that protects them. This flap of bone is called the middle turbinate. Now, as the septum keeps deviating, it actually pushes this middle turbinate closer and closer into these sinuses. So what happens is that the opening of the sinus and this turbinate is actually super close. So a little bit of cold, a little bit of exposure to AC, anything like that can block it up. And because that is a very narrow area, the congestion takes a long time to clear out. So that means that people who have a deviated septum and who have turbinate hypertrophy, about 40 to 60% of them will have sinus issues. And remember, if we are fixing it and we do not fix the sinus, this flap has already been pushed that way. So if I don't widen out the sinus and if I don't fix the position of this flap, even if I've done a septal surgery, even if I've fixed the septum, these guys are about 60% likely to start having secondary sinusitis in the next 5 years. So the idea of any of these things is that if I'm going to treat it, we must treat it perfectly. It must be a complete job, and nobody should ever see the inside of an operating room for a nasal problem more than one time. Okay, now let me go back to it and talk to you about, so if people come to my clinic, obviously they have all these problems, they have sore throats, dry mouths. That's again because you're breathing through the mouth every night. And because you're breathing through the mouth, your mouth is becoming dry, you're getting pain here, your throat is more sensitive, so you're continuously getting infections. If you drink cold water, cold beer, anything like that, you're super sensitive. And many times these guys have been told, oh, you have tonsillitis, you're going to have to get antibiotics. And actually, I have there's multiple videos on this made by me. You can always refer to them on YouTube. But the idea is that if you see these issues, when I see people in this situation, they've already been to 4 doctors, they've been told, either get a tonsil surgery or something like that. And it's not at all the tonsil that is troubling them. Their main problem that it is that it is drying out. And that's why their throats are super sensitized. So when something like this happens, what are the treatment options? Now, I'll be very honest with you. If your main reason why you have a nasal obstruction is because your nasal septum is deviated and you're a guy who's in this process where there's a deviated septum, there is a hypertrophy of these shells, which are the turbinates, you're having sinus issues, all these things, I do start people with some nasal sprays and anti-allergics and stuff like that. But frankly, we don't really have a lot of ways to treat it permanently. So the permanent solution for this is a surgery. Now, as soon as I talk to people about nasal surgery, one of the things that I hear very frequently is that, oh, doctor, I have spoken to people, but nasal surgeries, they don't last. They will last for a few months and all, then they'll fail. It's a very common thing that I hear. And the answer to that, is that true? Well, absolutely. If so many people are thinking about it, then that is true. But here's the deal. If you look at data from the US databases, which are the national databases, UK databases, Australian databases, you will see that our 15-year success rates are over 95%, which is some of the most high success rates that we get. So then we have to think about what is going wrong? Obviously, there's something. If these surgeries are so successful everywhere in the world, why is it that nasal surgeries get such a bad reputation in India? And the answer is really simple. So if my nasal septum is deviated, right? So the septum is like this. So if I cut off part of this that is blocking it or that is deviating it, that should be the solution, right? Make sense? See, this is exactly what doctors used to think. So we used to do this surgery called endoscopic septoplasty, where what we would do is we would take the deviated part of the septum and we'd cut it out. And it's not that that's a wrong surgery, but we've realized that that surgery has very limited uses. And in about 90% of cases, that surgery is not going to be a great result. And I'll tell you why. See, if you look at your nose, the human nose looks very different compared to a dog's or a cat's or some other animal's nose. And the reason is because with evolution, our face has actually got mashed in like this, right? So your nose, this point, and these two ligaments here, they actually work like a clothesline. And all our cheeks, all the tissues here, they rest on these 2 points and on this pillar. So this pillar is like the central point of a tent. Now, if I have a pillar and if my weight is falling on it like this, then that should be perfectly fine, right? So that should be perfectly fine, right? However, if my pillar is like this and my weight is falling this way, then you can understand that that pillar will keep buckling. Now, what will happen, do you think, if I take part of that already weak pillar and I remove a part of it? Is it a stronger pillar or is it a weaker pillar now? Hopefully, all of you are saying weaker. It is a weaker pillar. So if you create a weaker pillar than you started with, can that result ever be sustainable? Your body doesn't care about who the surgeon is or any of these things. Your body cares about the science. So if my pillar is deviated, the surgery can never, ever, ever be something as simple as cutting out a part of it and removing it. The surgery needs to be a repositioning. And this is something called functional endoscopic septorhinoplasty. Now, I have personally done over 1,000 of this, and there are many famous surgeons all over the world who are doing many, many thousands of these surgeries. And this surgery is all about returning the pillar into normal position. So what we do is it's still done completely endoscopically. There is no scars, no cuts on the face. But what we're doing is we are actually taking the deviated pillar, we are freeing it out, and then we are shaping it so that it fits perfectly. And then we move the pillar to the center and we stitch it to the bone. So that pillar now is not weaker. It's right in the middle position. And then the extra cartilage that we've taken out, that cartilage is what we use like a splint. Because remember, this thing has already been deviated. So there is a weak point here. So unless I strengthen it, that can still fail. So I need one more layer of insurance to make sure that this lasts lifelong. Because remember, most of the times when I'm doing the surgery, this is a 30-year-old healthy guy. I need to give him a nose that will last him for 50 years. I can't give him a nose that lasts for 1 year, 2 years, 3 years. So the answer to this is put the septum in the middle, use a splint, make a stronger septum. And with this surgery, patients get amazing results because remember, your biggest problem in these situations where there's a deviated septum is where the air is entering and where the air is turning. So where the air is turning is where there is maximal resistance to airflow. And unfortunately, if I see 50 people with nasal obstructions, about 45 to 46 of them who need surgery, their problems are right here where the air turns. At that point is where the maximal issues are, and at that point, doing that older kind of surgery is disastrous. Now, I do this surgery about 15 to 20 times every month, out of which about 5 to 7 times, I'm actually fixing someone's nose who has this problem and has had the surgery done where the part of cartilage has been taken out. And that's very frustrating for the patient and slightly frustrating for me if I think about it from your perspective, because nobody with a nasal issue should need two surgeries. More importantly, this surgery is an extremely delicate and extremely fine surgery which I do, wherein I have to take cartilage from the rib. So I take cartilage from the rib, I shape it, and I create a new nose for people. I love doing these surgeries. These are some of my finest works. But if you think about it, I would rather not do any of these if I can get everybody to do the correct surgery. So the idea for this is if you have a deviated septum, inferior turbinate hypertrophy, if you have an issue that is because of a physical obstruction to the nose, then the solution is a surgery. So the surgery has to be a repositioning and a strengthening. It cannot be a cutting and weakening. The surgery must include 3 components. It must include fixation of the septum. It must include widening of the nose. That means bringing those extra growth, the large turbinates back to normal size. And also, if you have sinus scarring and the middle turbinates are moved aside, we must fix those at the same time. So the surgery usually involves 3 components and those must be done. Now, sometimes when I'm doing the surgery in people like this, there will also be adenoids, which is extra tonsil tissues that have grown in the back. If that happens, then we at the same time we just go ahead and clean it out and fix that. So that's basically the most common thing that I see people for when they have nasal obstructions. The other issue that I see people for when they have bad nasal obstruction, they can't smell, is usually because of something called nasal polyps. Nasal polyps are a type of allergies. Now remember, not everybody who has nasal allergies gets nasal polyps. Only about 25 to 30% of people with allergies will ever get nasal polyps. These nasal polyps are like grapes. They're like bunches of grapes that hang from the nose down into the passage. With time, these things keep growing, and at a certain point they'll completely block the nose and completely obstruct your breathing. And a lot of times these surgeries will need to be repeated. And that is one other situation where nasal surgery gets a bad reputation from. Because a lot of times I hear patients who come to me and they say, 5 साल पहले I had a surgery done, नाक में problem था, 1-2 साल was okay, now I've got it back again. And the problem with this situation is that if as a doctor I'm doing a surgery, it is my job to be absolutely honest with you. So these nasal polyps are a type of allergy. They're not a cancer, they're not a tumor. So why operate them? What is the rationale? The rationale is really simple. So if you have nasal polyps, these nasal polyps are not growing from the bottom. It's not growing where the polyp is. It is growing right up from the top at the roof of the sinuses where their actual growing point is. So there is no way for me to hit them where they're growing without using an oral medicine. Now the oral medicines that can be used for this are things like steroids or things like antibiotics. The problem with that is as soon as you stop, these guys will keep coming back. So the rationale for a surgery is two. One is we're going to take away all the polyps and we're going to take away all the small sinus cells in there until the entire nasal passage is like one big open corridor. And how does that help me? It helps me in two ways. One is I tell my patients after I've done a nasal polyp surgery that, sir, you will need to do one rinse. You will need to rinse your nose with one medicine once a week for the rest of your life. If you do it for 5 years, the polyps will not come back for 5 years. If you do it for 10 years, they'll not come back for 10 years. If you do it lifelong, they'll never come back lifelong. However, that I can guarantee you. But if you stop doing the rinses, then they can come back. However, if they come back, I can guarantee you that after we do a surgery, you will not need to go back into the operating room again. How can I guarantee that? Am I superhuman? Is it because I'm an awesome surgeon? I mean, I'm pretty good, but that's not the point. The reason why I can guarantee them that is because now I have turned it into a huge corridor. Remember, the polyps have no nerves. They're painless. So now I can use my endoscope even in the OPD, and I can go, and if there's one polyp, I can just pluck it out without causing the person any pain. So that means that if we're operating for nasal polyps, the doctor, the surgeon is not the cure. The surgeon is just clearing the way so that the patient can use nasal rinses, which is totally safe to use for years and years and years. I have personally done a meta-analysis for over 10,000 people, which is available on PubMed, where we have done these rinses for more than 10 to 15 years, and we have found that not even one patient has had any issues with the rinses. So the rinses are very safe. We have the data, and my job as a surgeon is to get you to a place where you don't need steroids, where you don't need antibiotics, where you don't need oral medicines. We can keep you on just some rinses and keep you safe. So that is my main goal for operating on you for nasal polyps. Now, the other common reasons why we have nasal obstructions are simple things like nasal allergies. So you can have bad nasal allergies without any deviated septum, without any polyposis. In that situation, should we do a surgery? Absolutely not. Surgery is just a tool. There are multiple tools in our disposal. Our job as your healthcare providers is to identify which tool is the right one for you. So what do we do? How do we choose? So for a person with allergies, with environmental allergies, there are three main things that we can do. Number one is nasal sprays and anti-allergic medicines in a specific regimen to make sure that patient can be successful. If we can control, great. If not, the second option becomes to go ahead and do a immunotherapy in which we identify the things that are causing my allergies and we start injecting it into you. So your body learns to recognize that these are harmless and they're not going to do anything bad to me. Number three is a small surgery called PNN, or posterior nasal neurectomy. It is a slightly advanced technique, but it is very, very minimally invasive. And the main reason we do this is if a person comes to me and they don't have a lot of sneezing, all the other symptoms are controlled, but the main problem is that the nose keeps running. Irrespective of anything, if they're eating, the nose keeps running. If they see food, the nose keeps running. When they wake up, when they're in the middle of a presentation, the nose keeps running. In that situation, what we do is we will use a very, very minimally invasive approach, and we're going to take out the simple nerves that are causing that excessive nasal running. That is a very, very successful technique. It gives us about 98% success rate in 2 years and about 85% success rates in 5 years. Remember, even if you are in that unlucky 15% where you need that procedure, it's a very small procedure. It takes me about 20 minutes to do. And that's basically all there is. Now let's talk about some other stuff. Things like Anthroconal Polyp, in which this is not purely allergy. This is considered to be a local alteration of your immune system, which just basically means that some of the sinus cells in a localized area, there is a chemical dysregulation and they start behaving in a different fashion. So that means where nasal polyps is where all the cells in your body are starting to form polyps. These kind of polyps are where a specific area there's a chemical imbalance and that is starting to form a polyp. The good thing about this is that these polyps are very easy to operate and remove. But the important thing is most of the times these polyps are starting from inside the sinus. So if you remove the polyp and not the base of it, then that is 100% sure to come back. So that means that when I'm operating on a nasal polyp, removing it and improving it is really something anybody can do. But my job as a trained rhinologist and skull-based surgeon is to go ahead and nuke where it was starting from, because I want to leave no chances that it can come back again. There are other things that can happen, like different kind of nasal tumors. So all these tumors are fairly well known, things like inverted papillomas, nasal cancer, stuff like that. All of these guys we usually operate for. Some of them we need a little bit of radiation or chemotherapy for, but honestly speaking, most of these nasal tumors are being operated for. Now, once you've done with all of these things, then we have to come to the last point, which is adenoids. Now, remember, this is one of the key points that we see in children. So, ever since I came back from the US, one of the main problems that I find is that a lot of times children with adenoid hypertrophy are being treated by pediatricians and they're just being given, anti-allergics and paracetamol and stuff like that, and they're not being treated. So let me talk a little bit about this. This is wrong. This is against American college guidelines, and this is absolutely something that we must try to fix. So what are adenoids and what happens? So adenoids are tissues just like tonsils. So there are 3 tonsils. 2 are in the mouth, 1 is in the back of the nose. Now there are children between around 7, 8, 9, 10, 11 years who start having large adenoids. They may occur even without tonsils. That means that tonsils can become large if you're more prone to infections in your mouth. Adenoids can become large if you're more prone to infections in your upper airway. So if your adenoids are large, how do we know? Well, the child will grunt. The child will always have a runny nose. The child, when he sleeps, will be grunting or snoring or breathe through open mouth. His front teeth will be notched. He will have a lot of running nose. He will have continuous sore throats, frequent sore throats, but his tonsils are not big. All of these things tell us that there is something else that's going on. And the reason these children have frequent sore throats without tonsillitis is because that adenoid always keeps dripping that infected mucus into the throat. Now, these guys definitely need the adenoids to be removed. And that removal must happen as early as possible before the age of 12 to 13. Why? Because remember, your face has 3 parts: upper face, mid face, and lower face. The growth of the mid face is related to nasal breathing. So when a child has adenoids blocking that passage, this child is learning to breathe through the mouth. So what happens is, because he's not using the nose to breathe, his sinuses are not developing. Because the sinuses are not developing, this child, you can clearly see in pictures the difference in 1 to 2 years. Their face here will look blunt, it will look like this, and the mouth will look bigger and more protruded. That is called adenoid faces. The problem is, once that facial change has happened, there is no way for any doctor in the world to fix it. We can do different kind of plastic work and stuff like that to kind of camouflage it, but we cannot fix it. So if we have to fix these children, we must fix them before their facial changes have happened. Because once the facial changes happened, you have put them in a position where they're not going to be as good looking as they were. Their whole facial features have changed and they're more prone to frequent sinus infections. So if you look at these guys, these children must come over to us, to ENT doctors. And when we do these adenoid removals, remember, one thing is for sure, adenoid surgeries cannot need to be repeated. You cannot have a failed adenoid surgeries. Adenoids cannot come back. I hear this a lot of times that, oh, we had adenoids done, but it came back. The reason is because in the past, we used to do adenoids through the mouth. So the adenoids grow in an U-shaped fashion. So obviously, if I go in through the mouth and remove the bottom part of the U, the adenoids are going to grow back. They're just lymphoid tissues. So we can never do blind hope for God kind of procedures. When we do adenoids, we always use a nasal endoscope. We use a special tool called a co-blator, and every inch of adenoids have to be removed. Once you've removed every inch of adenoids, it can never, ever, 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 ever come back. So these are the most common causes of nasal obstructions and the most frequent surgeries that I do and the most frequent other treatment options. To sum up, the bottom line is that nasal obstruction can be many, many different reasons. So don't use Otrivin, don't use things like that to kind of treat it, because Otrivin and all these things worsen our results from surgery. If you have nasal obstruction that is bothering you, please see a doctor. When you come in and see us, it's not that we talk about surgery for everybody, but in many of these situations, surgery can offer you excellent, excellent results. I personally do big skull-based tumors. I do big neck tumors, but the guys that I do the septum and sinus surgery for are my happiest patients. They're the guys who go and find me, leave me reviews, leave me like excellent praiseworthy stuff and all that. And it's not because I'm doing anything fascinating. It is just three things. You must identify the right patient. So you cannot do a nasal surgery for a person who has just allergies and expect him to get great results. You must have the right patient. Number two, right surgery. There are so many times when I go in to revise a surgery and this patient has been operated 2 or 3 times and the surgery is incomplete. So just because I'm inside the nose with an endoscope doesn't mean that it is a complete job. So all doctors and all patients, we must do the complete surgery. If we're removing the sinuses, this ethmoids, it must be a complete ethmoid removal. If we're removing the sphenoids, we must be a wide sphenoid opening. So the work has to be very precise. Sinus surgery is one area where your rewards for a great surgery are fascinating, but it is equally unforgiving. Remember, a sinus surgery is being done to improve someone's quality of life. So if a sinus surgery is not done correctly, you cannot run away. You cannot hide and say, ha, maine kar diya. The patient will come back and find you and tell you that doctor, surgery se kuch fayda nahi hua. And there is nothing more frustrating than a patient who has gone through a surgery to have no benefit and a doctor who has done a surgery with no benefit. And number 3 is right post-op care. These sinus and nasal surgeries, all of it is in the post-op. I see my patients 3 to 4 times free of charge after every surgery. And the reason I do that is because once you have done a sinus, remember, you cannot do cleaning, you cannot do a dressing on the sinuses. So as they heal, there will be crust, there will be clots. If you do not remove these clots every alternate week or every week, then these crusts are going to get infected. Patients are going to have terrible results. Those crusts will inflame the surrounding mucosa, and the entire problem that you're trying to avoid will come back. Because remember, your main result for the surgery is to return the body to normal, not to change it. So if you understand these 3 things, you should be able to know that nasal surgeries are, when you've identified the right person, they're great surgeries, great results. If you have this problem, visit a nearby ENT doctor. If you would like to meet me and my team, we're always available. You can go to Apollo Spectra. I'm available there every day. You can also meet me on my website, which is drbhattacharyaent.com, and you can book appointments with Apollo or any of my other clinics at the same way. Okay. Thank you so much. If there's any questions, I'll take them. Otherwise, we'll wrap it up here.